Good afternoon, folks. I'm Dr. Brian McHugh, a neurosurgeon here in the West Islip area. I specialize in spine surgery for neck and back pain, complex revision surgery, and deformity surgery. We're here this afternoon to talk to you about living with a healthy spine and some of the things you can do on a day-to-day basis to hopefully avoid ever ending up in my office. I thought we'd start with a little bit of an overview of the types of problems you can develop in your spine. Some of these you're just born with. In the pediatric population, especially scoliosis patients, that can show up as a developmental issue. We can catch it as early as infancy, and most of the patients are in their teenage years. Unfortunately, there's a whole group of folks who will need surgery out of that period, and then there's a separate cohort that won't come to treatment, and then they deal with the issues that come up in adulthood with that problem. You can also be born with a couple different types of malformations of the vertebrae, which can make life a little bit challenging as you move into adulthood. But the vast majority of us are born with an arrow-straight spine, perfectly formed vertebrae, and cushion-like discs that sit between the vertebrae and allow us to walk in a nice, comfortable manner. Unfortunately, I'll buzz through a couple of these slides. There's a nice picture of, unfortunately, a young person with pretty bad scoliosis. As we age, there are some changes that happen in the spine that can sometimes generate issues. The discs in particular, those cushions between the vertebrae, they're these wedge-shaped, soft pieces of tissue, and we're relying on them for the curvature and alignment of our spine. At right around 40 to 50, they'll start to deflate a little bit, kind of like a car tire. And due to the shape of the disc, the fact that that wedge is lost and it starts to flatten out, starts to drive us all forward, starts to force the vertebrae to kind of collapse on one another. That can pinch nerves, bones can rub together. It's general arthritis, but it can create serious neck and back pain issues, as well as nerve issues that kind of shoot into your arms and legs. Now, we can't stop aging, obviously, but we can do a few things from a fitness standpoint to minimize the effects of what Mother Nature is going to do to the body. The slide that's up there now sort of shows the natural alignment of the pelvis at the hip bone. So that's kind of right around where your belt sits. And you really need an appropriate posture at that position to keep your back healthy and pain-free. That posture becomes a little bit compromised as we age due to those discs degenerating. So keeping nice and limber in that region is very helpful. Routine stretching of the hamstrings and gluteal muscles and keeping the core nice and strong really help to maintain posture right at the junction of where your spine meets your pelvis. In other words, right where your belt line kind of sits. These pictures show the whole spine and what the normal alignment of it looks like. So that curvature that's there is what it should look like. And unfortunately, all of that curvature is secondary to those nice fluffy discs that sit between the vertebrae. As those degenerate, like we said, like a flat tire, the spine starts to degenerate a little bit. So you start to get a picture like this one where various changes in the body kind of pop up, and you're dealing with arthritic changes in the spine, scoliosis in the spine where the structure starts to crumble, and pinched nerves like we talked about. Like I said, there's not really a way to prevent aging. I wish there were. If you can find the fountain of youth, please call me. But what we want to do is avoid tile A there. And tile A is a quick schematic of your spine, but it shows folks leaning over a far ways. You might see this in different folks in the grocery store or out walking around. That's what can happen when those discs degenerate too much and the spine falls forward. That creates a real pain syndrome in the low back and the neck, and if you add that to pinched nerves, you can be in trouble. So you want to stay focused on upright posture. So we call it military posture sometimes. You want to keep basically the head, the center of gravity, balanced over the hips and the knees and the spine. And like I said, routine stretching in the hamstrings and the hips and core strength, sit-ups, push-ups, those kind of everyday activities. Believe it or not, it sounds simple, but that can keep you nice, flexible, mobile, and with appropriate posture, which will prevent that panel A picture where you're listed forward, really using your back muscles and your neck muscles to maintain an upright, forward-looking gaze when you're going about your daily business. Because when you list forward like that, you activate all those muscles and make them angry and painful. And then, unfortunately, you're seeing me in the office, and we're talking about procedures and treatments that you'd really rather not have to do unless your hand is forced. Those are most of the basics. I think this diagram just shows people in this cone. There's this slight cone that everyone can tolerate, but once you get pushed from a posture standpoint out of it, it's a real issue. Spine health is critical as we age, and ultimately the spine is sort of the main structure support of the whole body. So if you let that degenerate, it can affect other things, hips, knees, ankles, and then you get into a whole slurry of problems that ultimately come to surgery, which sometimes are unavoidable, but certainly we all want to do the things that we can do to modify our risk factors and make sure we're set up for longevity and a happy, mobile, functional life as time moves forward. If you do have back problems or neck problems, feel free to reach out to us. We do have offices throughout the Suffolk County area. Thank you for your time this afternoon. I hope you enjoy the rest of your day.